our dear students. Today we will talk with you about treatment of tuberculosis and prevention of tuberculosis. It is our fifth lecture, and goals of treatment of patient with tuberculosis: cure sick tuberculosis, patient with tuberculosis, prevent death from active tuberculosis and its large sequels, prevent relapse in future, abort distribution chain infections, and anti-tuberculosis treatment can prevent the development of drug resistance in Mycobacterium tuberculosis. There are etiotropy, chemotherapy, medical and protective regime, balanced diet, pathogenetic therapy, collapse therapy, operational and spa treatment. Anti-tuberculosis drugs. In 1944 was developed streptomycin by Waxman. In 1951, 51st, isoniazid was developed by Fox. In 1966, rifampicin by Maggie. Popular in our time is a division of anti-tuberculosis drugs into two groups: main or vital or first row, used to treat newly diagnosed patient. It is isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. Reserve or other drugs which are used in patients previously treated but without the desired effect, often due to drug resistance of the Mycobacterium tuberculosis, or it's called second row. Anti-tuberculosis drugs, it is abbreviation by letter H, it is isoniazid. R, it is rifampicin or rifabutin. E, it is ethambutol. S, it is streptomycin. ET, it is ethionamide. Z, it is pyrazinamide. K, it is kenemycin. V is viomycin. PAS is natrium para-aminosalicylum acid, and T was thiazetazone. It is isoniazid, used in tablets by 0.1 gram, 0.2 gram and 0.3 gram, as well as an ampoule of 5 ml in ampoule of 10% solution. It is prescribed at dose 8 to 10 mg per kilogram. For an adult, 0.3, 0.6 gram after meals. According to World Health Organization, 5 mg to kilogram is allowed. The daily dose is prescribed once or twice. Our second drug, called rifampicin. Rifampicin is available in capsule of 0.15 or 0.3 gram and ampoule. Its daily dose is 8-10 mg to kilogram. For an adult, on average is 0.45, 0.6 gram, which is administered once orally 30 minutes before meals or intravenously, possibly in endobronchial administration. Our third drug is streptomycin group. Streptomycin is available in vials as in a dry powder. Before use, this drug is dissolved in 2 or 3 milliliters of 0.25% 100% solution of novocaine or isotonic sodium chloride solution. Streptomycin is administered intramuscularly in a single dose, which is 0.75 or 1 gram for an adult, or 15-20 milligram to kilogram. Ethambutol. Ethambutol is available in tablets at a dose of 0.1, 0.2 and 0.4 gram. The daily dose is to 20 to 25 milligram per kilogram for an adult, from 0.8 to 1.8 gram, and it's taken once after breakfast. Pyrazinamide. The drug is available in tablets of 0.5 gram. It is prescribed at a dose 25 or 30 milligram per kilogram for an adult, 0.5 gram 3 times or 1 gram twice a day after meals. Population of Mycobacterium in the human body. In this slide you can see the population of Mycobacterium tuberculosis in the patient body. It is metabolically active group, is continuously reproducing. Second one is intracellular located Mycobacterium and macrophages, and in an acidic environment they are reproducing. And dormant or persistent Mycobacterium tuberculosis is expressing period burst of metabolism. It is also pyrazinamide. Mechanism of antituberculous drugs. The antituberculous drugs have two main mechanisms of action. Early bactericidal effect. It is ability of the drugs to reduce the number of bacteria in the active multiplying subpopulation of Mycobacterium in sputum during the initial period of treatment. Second is mechanism is sterilizing effect, is ability to destroy or significantly reduce the number of bacteria in a dormant subpopulation, complete destruction of all Mycobacterium tuberculosis. Categories of treatment. First category, newly diagnosed pulmonary tuberculosis with excretion of Mycobacterium tuberculosis, called MBT+. Newly diagnosed pulmonary tuberculosis, MBT-, but with a large parenchymatose changes. Newly diagnosed extrapulmonary tuberculosis, severe form, for example, tuberculous meningitis, pericarditis, tuberculosis of kidney, spine, etc. Second category, it is TB relapse and poor treatment outcomes and other. Third category, it is first detected pulmonary tuberculosis, Mycobacterium minus, with limited parenchymal changes. Newly diagnosed extrapulmonary tuberculosis, not heavy form. Fourth category, chronic form of tuberculosis. Standard tuberculosis treatment regimen. First category, second category and third category. In the first category you can see 2 or 3 months were treated patient with 4 drugs. It is isoniazid, rifampicin, pyrazinamide and ethambutol. Or it may be 2 or 3 months isoniazid, rifampicin, pyrazinamide and streptomycin. During 2 months, I will show you. I'm sorry. During 3 months, we will begin to patient supported phase. It is 4 or 7 months with 2 drugs, isoniazid and rifampicin. It is treatment of first category of tuberculosis patient. Now we will talk about second category. It treatment 2 months with isoniazid, rifampicin, pyrazinamide, and ethambutol and streptomycin. After 2 months, we plus to prescribe him 1 or 2 months, isoniazid, rifampicin, pyrazinamide, and ethambutol. It is active phase of treatment. After finish of active phase, we start to patient maintenance phase, intensive phase, maintenance phase, or supported phase we called it. 5 months, 3 drugs: rifampicin, isoniazid, and ethambutol. What about third category? Third category, it is a light forms of tuberculosis, and in intensive phase we prescribe 2 months isoniazid, rifampicin, and pyrazinamide. During after this phase, we start to patient supported or maintenance phase. It consists of 4 months, 2 drugs, isoniazid and rifampicin. In the first phase of chemotherapy, newly diagnosed bacillary patient for main anti-tuberculosis drugs are prescribed. Intensive chemotherapy carried out for 2 months, and if bacterial excretion persists according to SMEA microscopy, it must be 3 months. Patient is in whom Mycobacterium tuberculosis was not detected during the initial sputum examination. The intensive phase of chemotherapy is carried out with 3 main antibiotics, after which they switch to taking true drugs for 4 months. Standard treatment with drug-resistant tuberculosis, it is 8 months. 8 months with pyrazinamide, capreomycin, ethionamide, cycloserine, and also 12 months by pyrazinamide, ethionamide, cycloserine, acetazone, and other. And you can see 8 plus 12, it is 20 months our patient with drug-resistant tuberculosis are treated. Effectiveness of chemotherapy is assessed by the dynamic of clinical manifestation, bacterial excretion, X-ray detected changes in the lungs, reduction of infiltrate changes in the lungs, and close of cavities. In the hospitals, prescribed chemotherapy drugs are taken under the supervision of medical personnel with the accurate account of the medication taken. On an outpatient basis, chemotherapy drugs are taken under supervision of medical personnel of anti-tuberculosis dispensary or in the patient's home. Control of facilities by the use of the entire daily dose in one dose is intermittent treatment. Irregular use of chemotherapy drugs can lead to development of Mycobacterium tuberculosis drug resistance and progression of process. It is very success. It is very dangerous. It must know all of you, and that's why I want to one more give your attention to this thing. Irregular use of chemotherapy drugs can lead to development of Mycobacterium tuberculosis drug resistance and progression process. Single daily dose of chemotherapy drugs are prescribed to create maximum bacteriostatic concentration in the blood. The duration of main course of chemotherapy is at least 6 months, from 6 to 18 months. All drugs in therapeutic dose act mainly bacteriostatically, and premature discontinuation of treatment leads to reserve of persistent Mycobacteria in other original forms, their new reproduction, and celebration of process. Criteria of efficiency of treatment is detoxification. 13 weeks mycobacterium isolation is stopping. During 1 to 4 months, mycobacterium cultural stop it in 2 or 6 months. Caused ineffectively treatment. Mycobacterium stability, drug intolerance, features of morphological change, and patient undiscipline. Trade efficiency treatment, effective treatment, and mycobacterium without bacterial isolation, mycobacterium with bacterial isolation, completed treatment, ineffective treatment, interrupted treatment, and continuous treatment. Tuberculosis prevention, kinds of prevention was it may be social prevention, sanitary prevention, vaccination, chemoprophylaxis. Social prevention, this is a set of measures aimed to improve the material, living and cultural level of population, increasing of natural resistance of the body. BCG vaccine is live Mycobacterium tuberculosis, but it is apathogenic, significantly reduced virulence. It has immunogenetic properties. It can induce immunity. In this slide you can see how it is look like the BCG vaccination, a vaccine of Calmette and Gerion. It is local post-vaccination reaction, infiltrate after 6 or 8 weeks. It is normal reaction. Infiltrate with a pustula covered with a crust, normal reaction to vaccine administration. And the depigmented scar, normal reaction. It is scar after BCG. Complication of vaccination divided in 4 categories. First category, local skin lesions. It is called abscess, ulcers, and regional lymphadenitis. Second category is persistent disseminated BCG vaccination without a fatal outcome. Third category is disseminated BCG infection, generalized lesion noted in case of congenital immunodeficiency. And fourth category, it is post-BCG vaccination syndrome, a disease what occurs immediately after BCG vaccination, more often all an allergic nature, erythema nodosum, rash, keloid scars. Sanitary prevention is improvement of cells of tuberculosis infection, timely detection of tuberculosis, sanitary and veterinary supervision, sanitary and educational work. Ways for timely detection is preventive examination when seeking medical assistance, observation for persons with an increased risk of tuberculosis, preventive examination children and adolescents, mass tuberculosis diagnostic using MAN2 test with 2 tuberculin units. From the age of 15, fluorography, adults, fluorography, person who cough for 3 weeks or more and produce sputum bacterioscopy for MBT 3 times. It is a method of detection tuberculosis in children and adults. MAN2 test with 2 tuberculin unit, positive reaction of MAN2 test with 2 TU, and groups depending on the methods of improvement of service is chemoprophylaxis, is use of chemotherapy drugs to prevent tuberculosis in healthy individuals. Primary chemoprophylaxis is carried out to uninfected person in order to prevent MBT infection. Secondary chemoprophylaxis is performed to previously infected individuals in order to prevent the development of these diseases. Thank you for your attention, and see you soon in our next lecture.